Dr. Mark Stoller, and I'd like to welcome you to Conversations in Primary Care, the role of diet and lifestyle in the management of diabetes, making it work for you and your patient. Joining me today is Davida Kruger, nurse practitioner extraordinaire from Henry Ford Health Systems in Detroit. Welcome, Davida.
Thanks for having me.
My pleasure. And today we're going to have a discussion, and truly a discussion, on how to effectively manage your patients with diabetes beyond pharmacotherapy. I think it's pretty clear that the most frustrating aspect of managing diabetes is successfully integrating nutrition, exercise, and just the complexity of having diabetes into day-to-day management. So, Davida, why isn't it working?
Well, think about what we're asking people. So you meet someone in their 40s, 50s, whatever age it is. They've already developed a lifestyle pattern. And we're saying, that's not working so much for you, and I'm going to tell you how to live. And this is what you're going to eat, and this is how much exercise I want you to have, and you're going to do it every single day. And we have to take into consideration their whole picture of life, and each patient is totally independent and different. And we don't always do that. We don't always sit and say, okay, this is what we need to accomplish. Tell me what your life looks like so we can fit this in. I think we just expect a lot.
And I think part of it is the whole process is probably not suited for behavioral change. You know, behavioral change is incremental. It's not, okay, I'm going to tell you to do this, and I'm going to assess how well you've done it at the next visit and expect it to really have moved the dial a lot. And I think that we as physicians have to take small victories in managing diabetes, and even the office process of when we see a patient in follow-up, it's like a report card, a midterm. Okay, have you done this? Have you done this? Have you done this? And often patients haven't been able to accomplish, instead of saying, what have you been able to do? I find it very difficult to interpret the success of adherence to the regimen without having an A1C in front of me at the time. How do you feel about that? Because many physicians don't have access to in-office A1C.
Right. So I think that's only one component, and we shouldn't always judge on just that one component. But again, it's a conversation, and I feel like every time I meet with a patient, there's a small piece that we're adding to that puzzle to help them be successful. And we call it the happy dance. So when a patient is able to, I'm not asking you to run a marathon. Tell me if you can walk more. Tell me if you can add just a small amount of activity, or let's talk about nutrition. So the patient who comes to you, and none of us learn nutrition. You didn't learn it in med school. I didn't learn it in grad school and did become a nurse practitioner. It sort of comes on you. But talk to them about, do you know what orange juice is? It's pure sugar. How can we get juice out of your life? Or I'm from the Midwest, we call it pop, soda out of your life. Just small things. So when a patient comes back to me and says, I haven't had any juice and I haven't had any pop, that's a happy dance. So small increments, talk to them about their successes and add to it. Talk to them about portion sizes. So, instead of having 3 pork chops, can we get it down to 2? Or can we get it down to then 1? And each time I meet with a patient, talk a little bit more about their success or how to help them be successful.
And you really touched upon 2 key words here. One is increment, meaning small victories, and the other is success. Yes. And every patient has small successes. They sometimes have equally small failures that negate our seeing any progress, but I think it's building on that. I think one of the other issues is just the whole language we use. So patients know that diet doesn't work because it hasn't worked until then. Right. Nutrition works. Yes. And so I think that term could be better. Patients hate exercise, but they don't necessarily hate physical activity.
Yeah.
And there's just subtle ways, I think, of communicating to patients that may make it easier for them rather than this draconian, this is the way it's going to be.
Well, I think the other thing, too, is that we have to live what we teach. So, I recently got myself a Fitbit, and, that's one of the things that before, I'm standing in front of the TV now doing some physical activity because this is telling me I haven't made my steps for the day, whatever your choice is. And so talking to the patients about how you've been successful and how you've made changes so they know that they're not out there on their own, but always making them feel good about what they've done. And it's also about building relationships. We see people who have a chronic illness. They may come back every 3 months, 2 months, 6 months, depending on the need of the patient. But you're not just going to talk to them about A1C and blood glucoses. You talk to them about, so how are the kids? Because if there's a problem with the kids, there's a problem with being able to be successful. So I try to make sure I know, who's going which way, and then maybe finding that small avenue. Wait, you have a half hour here. What are you doing with that? Can we get 5 minutes? Just 5 minutes for you to move around. And again, it's not a marathon that we're asking for. We're asking for you to move around a little bit more physical activity, and make better choices. And sometimes patients don't even know they're not making good nutritional choices. I mean, I'm a label reader, and that's where I start with the patients. I actually make grocery shopping a sport. So I take the box down, I read the label. If I don't like what I see, I put it back. Once it gets into my house, everything's free game. So talking to them about those kinds of things is, if you know what you're consuming, and even when you go to a restaurant now, there's the menu has calorie count. It has, I was at someplace last night and I read, wow, that cheese plate is 900 calories. That's a lot of calories for someone like me who's only 5 feet tall. So giving them tools to be successful, I think, is really important, and it's through our conversations.
Obviously, you don't have a screaming 2-year-old in the shopping cart when you're going to the store.
Correct.
But you raised the point of life gets in the way.
Absolutely.
And primary care health providers are so busy in the office. It's like, I don't have time to talk about what's going on, but actually, I think that's so essential, and just going, what's been going on?
Yes.
How's the past 3 months been? What's going on with the kids? Because the rest becomes moot and not likely to be successful if
Absolutely.
life has gotten in the way. I want to thank you for joining us today.
Thank you for having me.
It's our pleasure, and I want to thank everyone who's attended today's program. Have a great day.